So we're going to start with our assessment of the abdominals. Don't have a stethoscope right now, but I'm going to kind of explain what I would do if I did. So with the stethoscope, you're going to listen in all four quadrants. You want to listen for normal sounds of digestion. Gurgling sounds would be normal. You don't want to hear any flow, like water rushing would be abnormal. And then if you're not hearing normal digestion sounds or gurgling noises within 5 minutes of auscultation, this would be considered pathologic. So then we will move into a palpation. For palpation, you want to identify your quadrants. So you're going to go vertical and horizontal through the umbilicus. We have the upper right, upper left, and now we'll go lower right, lower left. You want to palpate the spleen, which will be in the upper left, liver, upper right, appendix will be your lower right. So we'll start with the spleen here. I'm going to start by lifting up under their rib cage here. And in a normal healthy person, their spleen will not be palpable. And they should not have any pain with that either. So if they have mono or any other infection that would cause the spleen to be inflamed and go under the rib cage a little bit where you could palpate it, they will have pain with that. Next, we'll move to the appendix while we're on this side. So you're going to find their ASIS and their umbilicus, and about halfway in between is where you find the appendix. We call that McBurney's point. Basically, you're just going to apply pressure there. If they have appendicitis, they'll actually have relief with pressure, and then they'll have pain and some rebound tenderness as you're coming off. So that would indicate appendicitis. Otherwise, normally they wouldn't have any pain there. Move over to the liver here, which is in the upper right. Here you go. Upper right quadrant. So you're going to lift underneath the rib cage again, and you're going to kind of go down and in. And the liver is palpable in a normal healthy person. You should feel pressure, and they will feel pressure as well. Pain there would be abnormal, rebound tenderness. Otherwise, besides that, basically you are just looking at tone. Any abnormalities would be bloating, tenderness, rigidity as well. Those would be considered abnormal. And you want to feel for any gaps in the muscle. Gaps would be indicating of hernias. So for the gaps, you would go just kind of in between the abdominal muscles here. Next we'll go into percussion. With percussion, you want to go into your quadrant, all four of your quadrants as well. You want to know the difference between hollow sounds and dense sounds, know what the organs should have and what they should sound like. So with the liver, should be more of a dense sound. With the stomach, I don't think we haven't eaten for a while, so she should have more of a hollow sound, and it is more of a hollow sound there. Over here. You just want to feel in between the muscles. Should be more of a high-pitched sound in between the muscles there. So, and that is the assessment of the abdominals.